Hello everyone and welcome back to Authentic Healing. I'm Vanessa, a licensed clinical social worker, certified women's mental health specialist, as well as a certified clinical trauma professional and psychotherapist. I am passionate about helping Black women understand the connections between mental health, trauma, relationships, culture, and healing. Today, we're discussing a topic that is often misunderstood, heavily stigmatized, and frequently misdiagnosed in our community. We'll explore what bipolar 1 and bipolar 2 disorders actually are, how symptoms can look different in Black women, the history of racial bias and misdiagnosis in mental health care, why many Black women are diagnosed late or incorrectly, and what healing and treatment can look like. If you've ever wondered whether your mood swings or just stress, just hormones, or something more, this conversation is for you. Bipolar is a mental health condition that's characterized by significant shifts in mood, energy, activity levels, and the ability to function. These shifts go beyond ordinary ups and downs. There are periods of elevated mood and periods of depression. There are two most common diagnoses, being bipolar disorder 1. Bipolar 1 involves at least one manic episode. Mania may include extremely elevated mood, increased energy, decreased need for sleep, racing thoughts, impulsive spending, increased confidence or grandiosity, risky behavior, hypersexuality, or irritability and aggression. In severe cases, mania may involve psychosis, including hallucinations or delusions. A manic episode is serious enough to significantly impair functioning or require hospitalization. Bipolar 2 involves major depressive episodes and hypomanic episodes. Hypomania is a milder version of mania. Someone may feel more productive, more energetic, more social, more creative, and more confident. And because hypomania can sometimes feel good, many people don't recognize it as a symptom. As a result, bipolar 2 is often mistaken for depression, anxiety, ADHD, burnout, or simply being a high achiever. Now let's talk about why this conversation matters specifically for Black women. Black women often carry multiple stressors simultaneously. Gendered racism, financial stress, caregiving responsibilities, community and historical traumas, and the strong Black woman expectations. Many Black women have spent their lives learning to push through pain. So when emotional distress appears, society often labels this as strong, angry, difficult, dramatic, or aggressive, instead of asking, what is this woman carrying, or what is she suffering from? Unfortunately, mental health research has repeatedly shown that Black individuals are disproportionately misdiagnosed within psychiatric settings. Historically, Black patients have been more likely to receive diagnoses involving psychosis, while mild disorders are often overlooked. For example, a Black woman experiencing severe depression may be labeled as difficult, non-compliant, or hostile. A Black woman experiencing mania may be perceived as aggressive, threatening, or out of control, rather than someone experiencing a mental health crisis. Research has found that Black patients have often been diagnosed with schizophrenia at higher rates, while mood disorders such as bipolar disorder have been under-recognized. This matters because the wrong diagnosis often leads to the wrong treatment. Several factors contribute to delayed diagnosis. Trauma symptoms can look similar. Many symptoms of trauma overlap with bipolar disorder. Examples include sleep disruptions, irritability, emotional reactivity, hypervigilance, concentration problems, or mood instability. Without a culturally competent assessment, trauma may be mistaken for bipolar disorder, or bipolar disorder may be mistaken for trauma. Depression gets more attention than hypomania. Many Black women seek treatment during depressive episodes. They may report exhaustion, low motivation, hopelessness, anxiety, or emotional overwhelm. But they may not mention periods of elevated mood because those periods felt productive or normal. This can result in a diagnosis of depression without recognizing the bipolar component. Many Black women normalize suffering. They may think, I'm just tired, I'm just stressed, I'm just overwhelmed, or I just need to push harder. Lack of culturally responsive care. Mental health providers are not immune to bias. When clinicians lack cultural humility, they may miss how racism, chronic stress, trauma, and cultural expectations influence symptom presentation. This can delay appropriate diagnosis and treatment. When bipolar disorder goes untreated, it can affect nearly every area of life. Your relationships, mood episodes may contribute to conflict, miscommunication, isolation, difficulty maintaining relationships, and career and finance issues. During manic and hypomanic episodes, overspending may occur, impulsive decisions may happen, and job performance may fluctuate. During depressive episodes, productivity may decline, attendance may suffer, burnout increases, and physical health may be impacted as well. Black women already experience disproportionately high rates of hypertension, cardiovascular disease, sleep disturbances, chronic stress-related illnesses, and mood instability can further affect physical well-being and self-esteem. Many women begin blaming themselves for symptoms they do not understand. They may think, I'm lazy, I'm failing, or something is wrong with me. In reality, they may be living with an undiagnosed mental health condition. The good news is that bipolar disorder is treatable. Treatment often includes medication management. Mood stabilizers and other psychiatric medications can help to regulate symptoms. Psychotherapy is another option. Therapy can help individuals to understand their mood patterns, to develop coping skills and improve relationships, to process trauma and build more self-awareness. Approaches like cognitive behavioral therapy, interpersonal therapy, family therapy, trauma-informed therapy, mindfulness-based interventions, or lifestyle support may be helpful. Research shows that consistent sleep, nutrition, physical activity, and stress management can play an important role in mood stability. As a psychotherapist who works with women, I believe we need to move beyond stereotypes and toward understanding. Not every emotional reaction is bipolar disorder. Not every strong emotion is pathology. Not every exhausted woman is depressed. And not every Black woman who is expressive, passionate, or assertive is angry. At the same time, we must create space to recognize when mental health symptoms deserve compassionate evaluation and treatment. Healing begins when we stop judging ourselves and start becoming curious about our experiences. If you are a Black woman or woman of color struggling with significant mood swings, depression, periods of unusually high energy, impulsive behaviors, or emotional highs and lows that interfere with your daily life, please know that support is available. You deserve culturally responsive care. You deserve to be heard. You deserve to be accurately assessed. and you deserve healing. If this video was helpful, please like, subscribe, and share it with another woman of color who may need this information. As always, remember, softness is not weakness. Healing is not selfish, and your mental health matters. So, thank you for watching today's video. I look forward to seeing you all in the next, and until then, take great care.